House Oversight Committee. Democratic Congressman Raja Krishnamoorthi sits on that committee. He joins us now. Congressman, thanks for being with us. How do you reconcile what Dr. Fauci told your committee today with what you have seen and heard from the administration so far, and particularly the president, who says, I think he said it was 15 cases that, may soon end 2 weeks ago, and, late yesterday it was, this is all just going to go away?
Well, I think that Dr. Fauci was telling the truth. I think that the cases that we identify going forward are going to be more numerous than what we've seen so far. And so it is going to get worse before it becomes better. And I think that does run contrary to some of the programming, if you will, or the spin that the president seems to put on what's happening right now. I think I saw a quote that he said everything's going extremely well. Well, as you can tell, most of the public does not think so. And it's having ripples in the economy, not to mention, obviously, the health impact on so many communities across the country now.
Also, just doctors that I'm talking to, they seem more concerned about this. I talked to a number of doctors just today and yesterday, and I was surprised at the urgency and great concern many of them are expressing about what they are seeing in hospitals. We learned at the top of the hour the president is, according to sources, expected to say tonight, as part of his comments tonight, that the crisis isn't America's doing, and he'll likely note the virus was first detected in China. Do you understand the point of why that would be worth the valuable time of the president and the American public?
Well, it's finger pointing, right? I think that he wants to potentially say that this was somehow a Chinese-sponsored virus, when, of course, the WHO today certified this as a global pandemic, meaning that it's something that has spread throughout the world at this point. And so now we're dealing with an American problem, not just a problem that was originally in another country. Because it is an American problem, now we have to move very quickly, for instance, with testing. And here we have been, unfortunately, flat-footed in terms of testing as many people as possible who may be in hot zones or in areas where there might be community spread, so we can get ahead of the virus.
The Health and Human Services Secretary Alex Azar still cannot say how many people have been tested in the United States, which I find remarkable. I was just talking to Sanjay Gupta in the commercial break. CNN's been calling around state by state to find out locally how many tests are being done to try to get an accounting of this. But the idea that the federal government doesn't know is kind of, I don't know, it sounds stunning to me. Is there a reason why they wouldn't want to know?
Well, I think that today we elicited the fact that Director Redfield of the CDC thinks that there's probably about 5,000 tests that have been done in total. But in comparison to some of our allied countries, so for instance, Korea or Italy or the UK, that is a paltry number of tests that have been conducted. Just as an example, in Korea, there they have tested 4,000 people for every 1 million residents, compared to the United States, where we have tested 15 people for every 1 million residents. So our allies, so to speak, are moving aggressively on this, and we're not.
The vice president has been saying, that 1 million tests are out there, and that all state, laboratories are able to conduct tests. All the accounts, though, of people trying to get tests, it is not an easy thing at all to get tested.
No, it's not. It's one thing to actually ship these tests, and again, we don't know exactly what the numbers are. We seem to get differing estimates on that. But really, at the end of the day, Anderson, it boils down to how many tests have actually been performed. And there we do run into a lot of constituent complaints that are coming into my office every single day, where people are saying, we don't know where the tests are. Doctors are calling health departments, and the health departments are saying they don't have test kits. And so we're basically running into a problem where we just don't have enough people being tested. That's the bottom line. And unless we can outpace the spread of the virus, if we cannot test more people or go at a rate that's faster than the virus is spreading, then we're not going to get ahead of it. We can get ahead of it, just like Korea and the UK have, but we've got to move very quickly right now.
Yeah, Congressman Krishnamoorthi, I appreciate your time tonight. Thank you.
Thank you, sir.